Well, good afternoon. Thank you. Thanks everyone for being here today. I was just saying to Erin that it's so exciting to see this room with the data and the way the staff team has put together today's conversation. Many of you know that last year we made significant changes in our SUN system in terms of our investment and prioritization around culturally specific organizations and culturally responsive services, and it was a big change for the community, as this is, and it's really reflecting the demographic shifts that we've seen in the community and our belief at Multnomah County at who's best to be reaching out to the changing faces in our community. And as somebody who's very much about quality improvement, to see that we've made some improvement in our own work at the department and how we're presenting the information and engaging you is wonkishly exciting for me. So thank you to the staff team for the work here. As I said, we're here because we have a shared belief that when we realize the talents and the contributions of all of our residents, all ages, all abilities, we can move our county forward. And that's something that we at the department are very, very committed to. And we also know that you, our community partners, are best positioned to do this work. You have a unique experience and expertise that you bring, and we very much value that. Over the last year or so at DCHS, we've really crystallized what our focus is, and we affectionately call it our North Star, which is to make sure that everyone has equitable opportunities to thrive. And what I know from working in government, working in the nonprofit sector, is that we can't do it alone, you can't do it alone. It's really that art and science when we come together to leverage the best of both of our worlds. So within every program that we have at the department, and any hopefully policy that we're working on, we have to ask ourselves, what impact will this have on people of different ages, different abilities, and different life experiences? And ADVSD recently conducted listening sessions with about 500 older adults in the community. 68% of the folks provided information to us in a language other than English, and nearly 9 in 10 were racial, ethnic, or cultural minorities. So while many people rely on our current services, we also know that we can do better and reach deeper into the community with our services. As a county, we want to see that all of our residents reach 100% of their potential. And as I said, in order to do that, it's going to take different strategies. We often talk about a term called targeted universalism. We want everyone to thrive, and what we know is that it's going to be something different for each person in each community in order to get to that goal. And we're committed to working with you to figure out what are those targeted strategies to get to those universal goals. We also learned that people turn to community-based organizations for much more than we imagined. In fact, as a little bit of an aside from my talking points, last year our Citizen Budget Advisory Committee wanted to go see our programs in action. I think our program offer descriptions are only so interesting. They really wanted to see what was happening. And they went to one of the senior culturally specific meal sites. And what they came back with as they sat and had meals with the seniors that were there is they were there not so much for the food. They were there for the connection of a community that looked like them, that appreciated them, where they felt a sense of belonging and connection. And the food was almost secondary to that sense of connection to the community. So it was great to have that experience and sort of remind us that it's about the services, it's also about how we do the work and where and what communities feel like in our aging system. We're committed to strengthening your organization, so we know that if we're going to ask you to deliver services, that we need to be a better partner also, and what that looks like. As somebody who used to run a nonprofit, the bane of my existence was government contracts, so I feel your pain. I can't, solve all of our contracting issues, but I like to think we've gotten a lot better over the last 2 years in terms of our timeliness of paying invoices. We're very open to working with you to make that experience better. And today, we're very much committed to giving you transparent information about what we're up to, why we're making some of the changes, and also giving you access to the Nonprofit Association of Oregon, who's turned into one of our most recent partners at the department level in offering you some technical assistance in order to best respond to the upcoming RFPQ. So a little commercial in the back table on the right-hand side. Is some information about the Nonprofit Association of Oregon, and I encourage you to check out. We are committed to working with them to provide professional development opportunities for you. So watch your email box this week. You'll get information from the ADVSD team. And then if you haven't signed up at the department level, we launched a quarterly nonprofit newsletter that comes from my office that shares with you what's happening around budget, what are some of the big trends we're looking at, and then also we'll offer to you sort of the free opportunities that you'll have through NAO to take advantage of some training. So look for that, very excited about that, and I believe somewhere we have folks from NAO in the room, so happy about having them here today. I'm going to turn it back over to ADVSD in a minute to give you the details, which is I know what you're really here for. And I think that the thing I just really want to leave you with is we've looked long and hard at our resources and at the community, and are committed to working with you and both existing partners and new partners to get it right, to be sure that we're providing those targeted strategies that I mentioned. And if you've got something that we haven't thought about and how to increase that sense of belonging in communities, we want to know that. And our sort of commitment around quality improvement is that we're open to feedback. We're open to improving our work as a county partner. So you have my commitment that we want to get it right. As I often say, I'm sure we don't all the time, but our intention is creating a sense of belonging in this community, and whatever role we can play in furthering that is our commitment at every level of the organization. So with that, I'm going to turn it over to you. Okay, thank you.
Okay, so I'm going to talk a little bit about the demographics, what's happening, what's out there. And I also encourage you to check out the maps on the wall because they go into more detail around certain racial and ethnic populations. And then we have more details and sort of there'll be a toy you can sort of play with to look and see where people live. That's not up on our site yet, but we hope to get it up there shortly as soon as we work through some of the technical challenges with the Tableau file. So people 55 plus, where are they living? This is pulled from the Census Bureau 2014, the American Community Survey. Basically, we've seen a growth of the over 60 population, about 21% since 2010. The cohort now represents about 18%, or 1 in 5 people in Multnomah County. Concentrations of older adults, you can see where it's darker. We can go in a little. Where the darker colors are is where there's higher concentrations of people per census tract that are older than 55. And I'll give you a little, let's see if I can find it. Here we go. So this also gives you an idea of the geography of our district centers. We have 5 regions that we break our services into. So here's east. Mid is this long rectangle. You have north, northeast, southeast, and then west is downtown, and then all this kind of area here. So what we know is that folks are moving mid and east. One of the questions someone asked in the earlier session is, how many people? Where are they going? What do they look like? It's a great question. We're going to be sharing as much information as we can get on that. And things are changing so fast, it's kind of hard to keep track of, but we're trying. So because people are going where it's cheaper, where there is affordable housing. We've seen the population age 60 to 64 grow about 30% since 2010. A 6% growth of our 85 plus population, which we know is, sometimes age does mean more services and more need there. So there's a big challenge ahead of us. I'll give you a little insight here into these are just the numbers. So for those of you that are more like the numbers, this is also available. I'll show you at the end where you can find this data on our website. This is just a little breakdown of where, if you look at, this is all 60 plus, excuse me, and then so people with disabilities, 35% of people with over 60. So that's a lot of folks. And this, just to give you an idea of what you can see up on these other maps here. So here's the African American population over 55, according to the 2014 census there. So you can just see where there's concentrations of folks living. And what I wanted to show about this in the other slide is just, that's why we need that targeted approach. Where do people live? What does this community need? If you look at the Hispanic older adults, we see folks are spread out all, people are everywhere. How do you provide services if you're one organization in one part of town? What does that look like? How do people, and we do see that people travel to come to our culturally specific partners. They travel to go and get services where they're comfortable. And so that's the question we're putting to you. What's the best way to serve folks? So that's all I have for you today. At the end I'll tell you how you can get those the links and look at those maps yourself. It's in our area plan and it's on our site. And now I'm going to bring up Erin Gray, Community Services Manager, and she's going to talk a little bit about who we are and what we do.
Yeah, that.
Do you want me to drive or do you want to do it?
Okay, that would be awesome.
Okay.
I could probably do it, but again,
Yeah.
you know, technology and I, not the best duo ever. I have other skills. Again, I'm Erin Gray. I'm the Community Services Manager with Aging, Disability, and Veterans Services. I've been in this role since April 1st. So I arrived just after we really started in my team really talking about this project and this RFP. So I just dove right in, which is exciting and terrifying all at the same time. But what I would first like to do is extend the warm welcome that you have already heard from Liesl and from Rebecca. We are very grateful to have all of you here with us today. We appreciate those of you who are our current partners. We look forward to future working relationships with those of you who have yet to become our partners. And I'm going to catch up to where my spots are on here. First of all, we are the Area Agency on Aging in Multnomah County. What that means is that really is a designation that stems from the Older Americans Act. And so we are charged by the Federal Older Americans Act to ensure that this kind of menu of services occurs in Multnomah County, in the greater county area, so all the cities that are encompassed within Multnomah County. So you see information and assistance, or the ADRC, which is Aging, Disability, and Resource Connect. And that really is the beginning of where someone could encounter the service system, what we call the network for older adults and people with disabilities in Multnomah County. In our office, we have 24-hour access for services, for information and assistance. So someone can call the helpline number and they will get a real life human most of the time. Every now and then high call volume, like I will tell you in energy assistance cycles, which we're in right now, call volume's a little high. But generally speaking, they get a real life human 24 hours, 7 days a week. And we're very grateful and proud that we are able to offer that service in that way. Other services that we have available, we are the front door to Aging, Disability, and Veterans Services in Multnomah County. So while people could go directly to any of the Medicaid branches to access public benefits, they also can come through that helpline, they can come through any of our senior district centers, and staff will help them get to where they need to go to access public benefits, to access Medicaid programs, to access the SNAP program, a variety of services offered in that body or that bucket that's considered public benefits. We have staff and volunteers who help with Medicare counseling. And again, those folks are out there in the community. So there are Medicare counselors throughout Multnomah County, and you can work through the senior centers to access that service. We have case management and options counseling, and I had to give a big plug for options counseling this morning and again now. Options counseling is an amazing service, and folks can come in through the helpline and get to a senior district center, and options counseling is that service that can happen for an older adult or a person with a disability or their family, the person who is loving and supporting them. So it's an opportunity to really talk with a person and their family, their support network, to really identify what their strengths are, what they've got going on, and what challenges they may be facing, and how they can look at their larger network to really try and plug those gaps. And it's an amazing service. Very grateful that it's part of our menu of options. We have transportation and coordination that come through our senior district centers. Nutrition services, and those are in the way of both congregate meals and home delivered meals. We have a large partner, the Meals on Wheels people, who helps with that service. They do the greatest bulk of the nutrition services that we offer. But we also have enhancing equity partners who do culturally specific meals. Health promotion and disease prevention, those are classes that are offered throughout the county through various senior district centers, and they're evidence-based health models to help really maximize an older adult's It helps some people who have chronic conditions, they can learn strategies to managing the conditions. It can be caregiver support classes. There are many programs, and they're in the Stanford suite, so they're very validated and research-based. We have an employee who has developed, who manages a family caregiver program, and that has a large network of volunteers, and amazing, makes the difference. You have folks who are living out in the community, and sometimes people's situation in the community is precarious, not just because of their own situation, but because they have loved ones who are supporting them, and I mean, we hear about caregiver burnout, so it takes all of these services to really support folks living out in the community and maximizing their lives to the best of their abilities. And finally, we contract also for legal services, and working through our system, we also do elder abuse prevention programs. As I've referenced, the way that we're contracting services currently is we have regional partners, and those are our traditional senior district centers, and those are the agencies or folks that are listed on the left. And then we also have what we call enhancing equity partners, and those are our partners that fall under the definition of culturally specific, as Liesl was referencing. So those are the agencies that really serve a specific population. They're agencies that are rooted in the communities that they serve, have history and traditions linked with those communities. And so those are our enhancing equity partners on the right. Finally, we're going to dive into the budget conversation. You go right ahead. I'd be dangerous with that. That red light makes me nervous. So this slide, and it's also, as Rebecca said, the slide with the budget is in your packet. And it's a very general slide. It just shows kind of what we're looking at for the annual RFP, and it breaks out some of the way that the different service categories are funded at this point. What I'm going to say before I talk about that, and I'm really going to talk about this only kind of briefly, because the other thing that I want you all to know is the program model for this RFP. We expect the program model to be up on the website, hopefully by the end of the week. And that program model digs in a far more specific way about kind of the history of why we're creating the RFP the way that we're creating it. It has a great amount of detail about each of the program areas, so those various ones that are reflected on these posters that you'll be having conversations with. It has so much information. It's very rich, and it really will help inform your understanding of where we're going and why we're making the decisions that we're doing. But the one thing that I really want to talk about in context of the budget is, you know, many of you who are our current partners, one of the things that we've been saying that we're looking at releasing this RFPQ, we've been saying that we're going to be shifting the funding structure, and that we're shifting it, as Liesl described, really in context of the core values of Multnomah County. That from a social justice perspective, what makes sense is to look at how you fund organizations to serve the populations that we all have in common. So that we need to look at how do people best receive their services, what gets to the best outcomes. And so that's why we've been engaging in this planning to look at shifting our funding allocation. I think that folks were hoping that we would hear what the allocation is today. And I am going to share that with you. And I'm sharing it with you because I think it's important to hear it all together, and in the name of being transparent. And the commitment that I have going forward is that after today, if folks, I'm going to be reaching out to all of our current partners, and whether it's me and Liesl or me and Peggy or me and Lee, we are committed to coming out over the next month or so and checking in with folks so that people can kind of talk through, have an understanding in greater detail about why we're making the funding decisions that we are. And I think that everyone understands from the philosophical perspective of why looking at a shift in funding, but to really understand the decision on the concrete numbers that we made. And I preface it with, understanding that the way that our current budget is structured, for example, is that 90% of the funds that we disperse through contracts go to our geographic partners, 10% go to our enhancing equity partners, and that just I don't think there's a person in the room who would agree that that's the right mix in terms of how we serve folks in the best way to achieve the best outcomes. And so, based on some really intentional work that we have done, we convened 2 different committees in the spring. Lynn led a group that was called Equity and Allocation, and that was a group that met for 5 meetings? I keep saying 4 or 5. That group was a group of folks who are not current contractors. So what their investment was, it was really in being the voices of diverse communities, but not having a current contractual relationship with us. And so we spent time with that group talking about the philosophy and getting feedback from various diverse communities about what made sense. The other group that we convened, Tina took the lead on, and that was a group of our current contractors. And that was, we had a meeting that was the same session, we just repeated it 4 times so that everybody could try and get to a session. And that was one where we really talked with our current contracting partners to talk about these definitions around what does it mean for an agency to be culturally responsive? What does it mean to be culturally specific? Why the difference and understanding the value and the intentionality behind the shift in funding. We also spent time with our current partners talking about, what works, what doesn't, as Liesl also referenced. Even in the best case scenario with a super friendly partner like DCHS and ADVS, we're still the government, and so contracting with us still involves a level of bureaucracy that's challenging. We know that, and our intention is to really figure out how to manage that bureaucracy, how to work with folks to get them the tools that they need. That's what helped inform the training curriculum that we're developing. It's what helped inform today. Our idea as we developed the RFP is really this idea of kind of creating your own adventure, the book, that's where you create your own adventure. So everybody would do the first part and then you move in to the second part and so on, so that people can really just have to engage in the parts of that cumbersome process that are relevant to them and their organization. So going forward, what we'll be working on doing and planning and how we'll be allocating funds is that in the new RFP, we'll be allocating 62% of our total funds to geographic partners, and 38% will go to enhancing equity partners. And we say that knowing that that doesn't come lightly to folks who are our current contractors. And part of the intentionality behind the work today is really to be talking about our program model and to talk about our different program areas and help create opportunities for people to be in relationship with other organizations to figure out how people can match up their strengths and partner together to serve the larger community in Multnomah County the best way that we can. I just want to spend a little brief more time and then I'll turn it over. Again, this will be in the program model, and also you'll be able to talk about it more deeply in your breakout sessions, but I wanted to call out a couple of areas that are changes for us. So in the program model, one of the areas that's a change is that we have always asked our regional partners, the district centers, to report the level of match and subsidy, so that if folks have to deliver service in case management or over and above a certain area, that they report, that they provide match, and also that they report any subsidy of their own staff or volunteers. We'll be asking all of our contracting partners to do that going forward. Another area is that we have always asked folks to engage in some level of customer satisfaction survey, but starting in the new RFP, we actually are developing a customer satisfaction survey within our agency so we're going to be taking that on for you basically. We're creating a model, it's being piloted in a couple of our branches now, and so look for that to come, but we will be looking for your participation so that we can be measuring satisfaction of our consumers and that we're getting consistent information across our network. Some of the other service delivery changes. Well, we've all been working on the same podium for the day.
Oh, check underneath the...
Oh, there's my papers. Thank you. Couple of key areas, and then I'll turn it over to Lynn. We will be for community focal point services for older adults. We'll be allocating up to 20% of community services for older adults to Community Focal Point. And so Focal Point is one of your tables. I encourage you to drop in. In the area of information, referral, and assistance,
I'm sorry, can you
yeah.
say that again? I missed the relevant.
ADVS is allocating up to 20% of the community services for older adults funding to Community Focal Point for older adults. Thanks, Maya. In the area of information and assistance, one of the changes is that we're shooting for greater consistency with the AIR standards, and so within that, anyone who applies in their RFP proposal will be asked to meet certain standards in the areas of technology. It will have to do with computers, with phones that allow for hopefully warm transfers, with headsets. So there are some things around the AIR standards that we will be requiring of any agency that we contract with for INR and INA. In the area of evidence-based health promotion, that's one which, and this budget sheet speaks to that. We'll be pulling, currently that's done, we have a couple of enhancing equity partners where that's something that they've selected from the menu of services that they've been able to select from. And then otherwise, it's the regional district centers who provide and deliver this service. And we're pulling it out so that district centers can apply for it, geographic partners can apply for it if they want to, but also it will be a standalone service. We have some folks out on the network who really all they would like to do. They are, rooted in healthcare and, healthy aging practices, and so evidence-based health promotions will be standalone. So this kind of speaks to that idea of that create your own adventure, that you'll be following along, do all the initial stuff that all of the county's RFPs ask you to do, and then start selecting, oh, I want to apply for this, I'm going to write that. Oh, I want to apply for that, I'll write those two. So that's an example. And finally, the area of nutrition services will also be one that we're kind of pulling out and will be a standalone thing. The way that we've been delivering nutrition services, as I said, is that our primary provider has been the Meals on Wheels people. And then it was also on the menu for our enhancing equity or culturally specific partners. Now we're opening it up. So folks could apply for congregate meals, they can apply to deliver home delivered meals, and then also culturally specific meals. So that will be a wider avenue to applying to serve in that program. Really, our intention is twofold at the end of the day. Our intention is to create the greatest amount of equity and access for all of the people who live in Multnomah County to have services that start to reflect and serve the community in a much more culturally specific way. That's the value of our agency as a division, as a department, as a county. And that's one piece. The other piece that's really important to us, and that and it's why we're trying to write the RFP the way that we're trying to write it, is to create an opportunity for you all, for our current and future partners, to be able to play to the strengths of your organization, to reach out to other organizations who have similar mission, vision, and values, figure out where are ways that you can partner to deliver services the best for all of the residents of Multnomah County. So thanks for being here again today.